Hi, good morning, everyone. My name is Dr. Sushant Khurana, and welcome to the another webinar of Kothobokothon. The reason why we started Kothobokothon was to have eminent speakers with us from the Bangladesh healthcare industry and understand their views about how healthcare has evolved, how new things have coming in shape, how patient care has taken place. And for today's session, I have someone very special with me. I have Professor Dr. Mohommad Aslam Hussain, who's one of the renowned cardiac surgeons in Bangladesh. He started his work as an assistant professor of cardiac surgery at Bangabandhu Sheikh Mujib Medical University way back in 2006. Now he's working there as a professor and HOD for cardiac surgery at the Bangabandhu Sheikh Mujib Medical University. He's a beating heart coronary surgeon, and his areas of interest are adult cardiac surgery, congenital cardiac surgery, and minimal invasive cardiac surgery. He also has to his name around 3,500 open heart surgeries. It's such a pleasure to welcome you, sir, on this webinar. Good morning once again, and hope you're doing good, Professor Aslam.
Good morning, Sushant Khurana, also you two and also all participants. It's my privilege to talk with this in this forum. So let us start.
Great. Thank you so much, sir. We'll just generally start with how the cardiac health, how the patient should perceive cardiac health. Let's say when he talks about what would be a general advisory that you would want to give to the audience in terms of what are the risk factors, how the role of diet or exercise has evolved in maintaining a person's cardiac health?
Yes, this is a very good question for my audience because audience should know regarding the cardiac health, how cardiac diet and exercise maintain the cardiac health. Proper diet is very necessary for that for all the cardiac disease like acquired cardiac disease, the coronary heart disease is mainly it depends on your environmental factor like your diet and also the exercise. Diet, if the high cholesterol and this diet causes coronary heart disease. So regarding diet, if we maintain the healthy diet, there should be decreasing there no blood increasing blood sugar, there will be decreasing blood pressure. This pressure, if you control the blood pressure and control the blood sugar, that is diabetes and blood pressure, if we control, if we do not smoke, these are environmental factors, we can prevent the heart disease. So dieting is a major role. Also the exercise. If you control your weight, that is, do not begin the weight that is not you will become the obese. There is less chance to become the coronary heart disease. So in modern mode of death in heart disease, the ways most of the cases heart attack due to coronary heart disease. If coronary heart disease is prevented by maintaining a proper healthy diet and exercise, we can prevent major heart attack. So what are the proper diet for preventing heart disease? We have to know this. Can I discuss this?
Sure, I'll come to that question a little later, sir. We'll take that advice for the audience.
Okay.
One thing I would also want to understand, like you said, it's a lifestyle modification disease as we speak. How has
lifestyle modification?
How has the cardiac disease in terms of change in terms of the patterns? Let's say, what kind of patients were you seeing earlier? What kind of patients are we seeing earlier? Do our newer jobs with relatively slightly higher stress, our lifestyle changes that we have seen in the last 10, 20 years, are they also responsible for certain cardiac diseases?
Actually, I'm not clear regarding your question, but
so generally the changes in pattern.
Did you want to know the pattern of disease change in cardiac?
Actually, if there is a pattern of disease that you've seen change in your practice, let's say when you started practicing 20 years ago and now, is there any change in the pattern of the disease at the people who come to present? I also understand a lot of young patients come with cardiac diseases now these days as well.
Definitely. Actually, in the starting of the years, you told me the 20 years back, there's a lot of patients of the valvular heart disease because in this area, there's the rheumatic fever was big prevalence in this country. But within 20 years, this is dramatically changed. Now the rheumatic heart disease patient is rare. But though it is available some valvular heart disease, it is the patients of 35, 40 years of age. Now the young age patient, that is 20, 20, 25, 30 years patients, they're very rare valvular heart disease. So there is a dramatic change. At the opposite side, uh, below 40 years of age, lot of coronary patients, coronary heart disease patients are available now. The young patients are gradually becoming more, that is ischemic heart disease patients are now uh, becoming younger patients. That is 40, less than 40 years of age, more ischemic heart disease patients now we can get. This is due to the change lifestyle modification. This is the change of lifestyle, the change of diet habit, change of environmental practice habit. That is, they are smoking. They do not maintain the pressure. They become overweight, obese, diabetic. For this young generation, for these regions, we are getting more ischemic heart disease patients from below 40. But 20 years back, it was not so much.
True that, sir. True that. I think a lot of lifestyle changes that we brought in our jobs or in our lifestyles have led to these modification in terms of the disease pattern as well. So when we talk about the improvement in treatment, let's say when we talk about the technology in the field of cardiac surgery, how do you think that has evolved over the last 20 years, and how does it benefit the patients?
Evolved of the cardiac surgical technique, that is actually within 20 years, a lot of development in the technology of the cardiac surgery. Previously, we do the open heart surgery in the form of open, whole X open, that is the mitral valve replacement, aortic valve replacement, that is the midline sternotomy, whole line, whole thickness of the whole sternum will be open. Now, the system has changed. There's a dramatic change. That we can do transcatheter, TEVAR, transcatheter aortic valve replacement, transcatheter mitral valve replacement. We can do the endoscopic surgery, laparoscopic surgery.
And these are
Just
all seem to benefit the patient outcomes as well. All these techniques
benefit of the
benefit the
patient,
patient
actually these are
outcomes.
so much, the benefit of the patient, these are though costly, but total benefit is patient is staying so much small, but the long, there's no stay longer period in the hospital. They have only minimal incision, minimal scar, early recovery, and then early they can join they can join their work. These are the benefit.
Fair enough, sir. So, and when we also very basic question, let's say for our general audience, when patients come with for a cardiac treatment, sometimes they are given an option of a surgery, and sometimes they are given an option of a stenting. So, as a layman, how would you want to explain it? Let's say when is a CABG done and a stenting done, as compared to when is a cardiac surgery or a bypass surgery done?
Yeah, the patient come to the doctors with their angiogram report, CD, and I can explain the patient regarding the when it requires stenting or it requires CBG. That is a single vessel disease, single vessel in a single site. That is not the diffusely diseased. What's a single vessel in different site, whole length. This is diffuse, single site, small size lesion that can do stenting. But a single vessel disease, if it is diffusely diseased, that is more than two sites, that requires CABG. Triple vessel disease, it is better to do CABG. If the patient don't want CABG, they can do, but there should be lesion small, but vessel should be more than 2, 2.5 millimeter diameter. If it is less than 2 or 1.5, it is better to do CABG.
Fair enough.
And when a calcified vessel, but left main involvement, left main coronary is involved more than 75%, 80%, it is better to do CABG, not to try by stenting
Okay,
for the
fair enough.
benefit of the patient.
Fair point, sir. And sir, what are some of the lifestyle changes that a patient has to undergo once he's undergone a CABG? If there is a patient who has underwent the surgery and is doing fine, what kind of precautions should he take, and what kind of lifestyle changes should he do after the CABG?
Yeah, patients, post-operation patient, when discharged, we can tell the patient that it is the operation is like your fever. You had a fever, we have give the paracetamol and your fever is removed, but the cause of the fever is not vanished. That is the ischemic heart disease. It's systemic disease. This is the disease. cause of the disease is not removed by the operation. Operation is the bypass. Sometimes I explain the patient, you will go to from Dhaka to Rajshahi, main road is blocked, so you go another bypass route. So the coronary bypass surgery, that is like the bypass.
Yes.
Main road is blocked, so you can bypass the block, but your block is not removed. So if you modify your lifestyle, then another block will not create. So patient, we tell the patient to control your weight, control diabetes, stop smoking, and also maintain the drug, that is drug which causes the that's the antiplatelet drug,
Yes.
which blood clot will prevent the blood clot, and also you will maintain regular exercise. That will increase your lengthy life, and post CBJ life will be very much helpful, and he can join the work after 6 months, his ordinary work. Every after 3 months he can work, but after 6 months he can join fully his work, except some professional job. I described them
Oh, that
differently.
is brilliant. That is brilliant. If they after 3 months they can go back to work, and 6 months they can go back to their normal life. I think that's
Yeah,
a
yeah, yeah.
brilliant thing. Sir, coming back to the first point that we started, when you were advising some recommendations in terms of what kind of dietary things the patient should use, or what kind of dietary habits a patient should have that will benefit his cardiac health. If you can elaborate on the diet.
Yeah, yeah. Diet, regarding diet, I always tell them they could always take fiber containing and also fruits. One of the item in the day, all day food, whole day diet is fruits, vegetables, and fiber containing all fibers. That is our vegetables and food, fruits, and they will not animal. They will as much as avoid the animal protein as far as possible. Plant protein they should take, and I list them. These are the plant protein you can take. And regarding diet, they should take some dairy product, but not so much. And also avoid smoking. Avoid smoking. You should avoid smoking. The practice of the man, the majority of my patients are diabetic, so they can strictly control the diabetes by dieting and also exercise, also drug. So the diet, regarding diet, we have a Mediterranean diet, as you know, the two types of diet, Dash diet and Mediterranean
Yes.
diet. In Dash diet, there is low dietary fibers, low dietary protein, and also dietary fat, and also there is some animal protein. But in Mediterranean food, all are plant protein, seafood, and also the plant protein, and fibers and fruits.
Fair enough, sir. Sir, also probably just to end, what advice or what recommendations would you give to someone, let's say who thinks, let's say who's above 40 years of age, what kind of regular tests should they get done to understand about their cardiac health? Are there any regular checkups that they should attend or go for, let's say after a certain age? Does that help too?
Yeah, after 40 years, they should start yearly. They should measure their blood sugar, chest X-ray, ECG, and if necessary, suggest an echo. And also their liver function like LGBT, creatinine, prothrombin, and also the kidney function like creatinine, and also their um, if ECG suggests they should be do echo
Right.
every year. They should do it.
Right, right. I think some of the points that we have discussed should be very, very beneficial for the audience. Any general advice that you want to give before we end this discussion?
Yeah, for the audience and for my patient, I always tell them your good heart means you have good health. If you have good health, your life is good, and you stay in this earth as a king if your heart is remain healthy.
Thank you so much.
So always maintain your control your weight and maintaining the healthy diet in your life. You will enjoy a lot.
With that advice, thank you so much, Professor Aslam, for your precious time. I hope all the audience would be benefited and we would follow your recommendations. I personally would follow some of them. Thank you so much for your time again, sir.
Thank you so much. I'm very much privileged by talking with this and sharing my knowledge with you and the audience. Thank you.
Great, sir. Have a very good day.